As of June 1st, the emergency room in the Haliburton town of Minden will close. The move came as a big surprise to both year-round and seasonal residents. And despite the short notice, they are not giving up without a fight. With us now for that perspective in Perth, Ontario, Dr. Alan Drummond, physician and emergency medicine advocate with the Canadian Association of Emergency Physicians. And here in our studio, Patrick Porzuczek, spokesperson for the advocacy group Save Minden Ontario Emergency Room. Welcome to both of you. Thank you so much for joining us.
Thank you for having us.
Now, Patrick, I'm going to start with you. You heard about this closure. You jumped right into action, got signatures, set up a petition, became the group's spokesperson. There's a personal story to this as well. Why is this so important to you?
It's so important to me because we have a 6-year-old daughter who has had some heart arrhythmias happening. She's always telling my wife, Laura, and myself that, you know, my heart's beating really fast, I'm having some problems breathing, and I suffer myself from atrial fibrillation and Wolff-Parkinson-White syndrome, so I know how that feels. Every time we try to get her to the ER to catch it, it basically starts and stops at the same time. The one day, this is about 8 weeks ago, the kids were at the local arena where they were doing different sessions for kids in the evenings after school. My daughter and her older sister were in a dance class. She left the group, went over to the wall, tried standing back up. We seen her grab her chest. She sat back down, and she seen the kids doing their dance. She wanted to get back in there, and she started walking over to the group. And she looked up at myself and Laura, who were we were on the catwalk above, and she grabbed her chest and she started walking out. And I said, "Kinsley," I go, "is it your heart?" She's like, "Yes, Dad." Right down the steps I went.
Right.
And went down there. I measured her heart rate. She was between 270 and 280 beats per minute. You can actually see her chest moving. And I said to Laura, we're gonna go right now. The ER is not even a block away. Before we can even get EMS there, I felt comfortable enough with my own training in that I'm good to go. And my wife said, "Yep, go." So got to the hospital, walked in, and there was 3 people waiting to be triaged. There was one in triage. The nurse was doing her thing to triage these patients. And I said, "My daughter's in an arrhythmia." And right away, she looked at the 3 patients, looked at us, "Get with us right now."
Right.
So they knew the urgency to catch it. They hooked her up and found out she was in SVT at above 245 beats per minute. Not even within a week, she had a pediatrician. Not even a week after that, she had a pediatric cardiologist, which we were able to meet. We were then told that she has a dual AV node. She has one located right next to another. It's like taking the 400 highway, the 401 highway, going into Toronto. It's your constant route, goes up and down, peaks and valleys, and responds with you. Right beside that, it's like having the 407. You got that straight shot, you know, press on the gas and let's keep going. With that being said, so when the secondary AV nodes gets triggered, the way the doctor explained it, well, now you got the one path going through at the normal rate, and now you got this ultra-fast highway going through at the same time, which causes the heart to go out of sync and then go into these rhythms.
Fair to say she's doing better now?
She's doing better. She's on medication. Thankfully, after being able to have that cot at the Minden ER, the doctors were phenomenal.
All right, so with that, Haliburton Highlands Health Services announced the change on April 20th, effective June 1st, that the ER would close. What's the response been so far from your organization or from that organization with your group's concerns?
So a lot of things, like we've presented them, we've asked them to come out to our group, speak to me, speak to 5 members of the public, you know, let us hear what the plan is. That's the one thing that's on everybody's mind in Minden is, you know, they give this announcement on April 20th, the hospital's closing June 1st. No pre-warning, no real talk about it, and there's no plan. So now we lose accessibility for all these people in Minden that can't drive, they don't have access to make their way 25 minutes east of the city to get healthcare. It's really, really impacted all of us there, and they're basically taking this all away. So when we asked the questions, what they said was, we're working on a plan, there's no plan in place. Council didn't know about it. All the county's council didn't know. So from Minden Hills, from Dysart, from Algonquin Highlands, nobody knew. So it caught everybody off guard. There was no hints given. And then all of a sudden they said, "Too bad, we're closing it. You guys have nothing to say or do. We did our own private, volunteer committee consultation. This is in the best interest of Minden Hills and that site. Unfortunately, it's not in the best interest."
All right, I want to get Dr. Drummond in. Unfortunately, you are familiar with ER's closing. You dealt with the ER closure in Perth in 2022. How did that affect your ability to meet the needs of the community?
Well, I'm glad that Patrick's daughter got excellent care and care in a timely manner. That's good to hear. Yeah, I've been there, and I totally get what Patrick has been saying. A rural hospital is, the lifeblood of that community to a large extent. It's not like a city hospital. It usually seems to be the epicenter of healthcare delivery for the region. And yeah, last year we were closed for 3 weeks in an unprecedented closure because of staffing shortages, particularly of nurses. And I too have heart problems. I had a daughter who had cancer. So both as a physician, but also as an individual and a patient, I know the uncertainty that happens when a hospital closes. I'm not an apologist for this government in particular, and communications strategies in healthcare over the last 2 years have been frankly abysmal. So I understand the piece about lack of public consultation and the uncertainty that plays on the minds of Minden residents and people that come to the community during summer months, as they do with ours. But here's the reality of it, is that at the end of the day, a hospital has to decide whether it can provide a designated service and make sure that if they are planning to maintain a service, whatever that be, whether it be emerge or obstetrics or surgery, that the hospital has the capabilities to support that service. Unfortunately, I think Minden is becoming probably an example of what's to come in our province as we tackle with this nursing shortage brought on largely by the actions of the Ford government or the inactions of the Ford government, but also physician shortages as well. And I know the government likes to think, well, we can just get more foreignly trained physicians and nurses, but that doesn't solve the problem of rural coverage, which is a different breed of cat altogether, as well as emergency department medicine, which is a team approach and requires more than just somebody with an MD license and a pulse. So I assume that this has been a hard decision for them, that they have not made this lightly. But again, the consultation piece and the communication piece seems to be really sadly lacking, and that's really unfortunate. What you do not want to have Patrick's daughter show up to an emergency department that is suddenly closed at midnight because there is no doctor there or there is no nurse there. You really don't want the planned or the unplanned disruptions to affect service delivery, and that's what's happening across this country. So, Minden has made a local decision, rightly or wrongly, but as a province and even as a nation, I think we need to start looking at the issue of rural emergency service delivery and how we're going to best meet the needs of Canadians with a declining base of both physicians and nurses. So how do we make sure that there's reasonable access to quality emergency care within a timely manner, but not have emergency departments shutting down unexpectedly at midnight or 8 o'clock in the morning because nobody showed up for work?
All right, so I want to we bring out a statement. We reached out to Sylvia Jones, Ontario's health minister, and received this comment from her spokesperson, Hannah Jensen. So it reads, the Haliburton and Minden ED sites are being consolidated to one site in Haliburton to provide more timely access to care. It is not a closure. This decision was made carefully by Haliburton Highlands Health Services Board and leadership as they're responsible for daily operational decisions. The consolidation will ensure patients are receiving emergency care in the location that is best equipped to provide urgent acute care, as the Minden site was used primarily to stabilize patients before being dispatched to larger centers and did not have any inpatient beds. The Minden site will remain open for some services and will continue to serve the community. Patrick, I'm going to get your take on it, but I do want to make sure we get this right, that whether it's a consolidation or a closure, what this would mean is it's a 25-minute journey out into Haliburton to see acute care. But first, with that, your response to the statement.
So my response to the statement is the consolidation, or whatever you want to call it, let's call it what it is. It's a closure. Consolidation, amalgamation, it's a closure. They're removing the blue H off the hospital nobody can no longer go there. They talk about the doctor and nurse shortages causing almost 22 episodes of where the emergency room was going to close, and that was all at the Haliburton site, not actually at the Minden site. There was many articles put out last year that if one was to close, that they already had in place with radio, with signage and everything else. This ER, please call ahead, just in case, please go to the other one. But people knew that, we accepted that. So when they talk about consolidation, it's just their way of saying, you know what, we're done with this, we're washing our hands, we're not calling it a closure anymore, we're gonna try to spice it up, make it sound better. Call it what it is, a closure's a closure.
All right. Dr. Drummond, around 160 hospital closures have affected Ontario, and in Minden they were given the short 6 weeks notice. What kind of support do emergency rooms need to avoid this?
Well, most of the closures, and keep in mind, this is pretty unprecedented. You know, we haven't had a closure of an Ontario Emergency Department for close to 15 years, I think, probably. And that was because Ontario led the way in the country in terms of maximal support of rural communities through both a Health Forces Ontario program, which would, basically parachute in physicians when community hospitals were facing a shortage over a weekend or a week or whatever. And that was a very successful program, so kudos to them. And also they had put in around the year 2000 a funding arrangement that supported rural physicians to maintain active coverage during the low volume midnight hours so that a doctor could afford to work overnight and get some rest the next day. Now, those two programs were superb. Most of the closures currently are on the basis of nursing shortages, which is not absolute, but rather relative, and largely because nurses are fed up with this particular government and their approach to the Bill C-124 or whatever it was that capped their wages. After 3 years of COVID, they expected more than rhetoric. So this is a crisis of the government's making. It is not an international shortage. It's just a relative shortage of nurses going elsewhere. Going forward, I think we need to have a more robust provincial, even national program about what we do with rural service delivery, because it's not just Ontario. It's also a lot of the provinces in the Maritimes are chronically closing. Interior of British Columbia, same thing. Southwestern Manitoba, same thing. It's just new to Ontario. And rather than make this kind of an ad hoc, one-off approach, I think we need to look at, what is the reasonable expectation for a rural Canadian in terms of timely access to quality care. Most of us think it's around 30 minutes, which sort of covers dry roads on a good day. And if you are going to close an emergency department, then by God, you had better have a plan in place to make sure that when those rare critical cases do arrive, that there's adequate ambulance service and good communications to allow for rapid access to the next nearest available emergency department. And so I hope that has been considered in this particular decision.
All right, Patrick, you get the last word. I have about a minute left.
Sure.
But you brought a contingent this week to Queen's Park to, again, bring the awareness. This was the second time that you had visited Queen's Park. There's a lot of focus on this. There's even a community member who's brought on a human rights complaint against the closure as well. What is next for your group?
What is next for our group? First of all, I want to address the nurses shortage. I actually received an email yesterday from a nurse that's actually been applying to the hospital for the last few months. A lot of people moved to the Highlands during COVID. A lot of these nurses from cities and what have ER experience applied, and they never got a look. Yesterday, she got a response finally from the HHS saying, hey, we're looking at your resume. Well, now they're looking at it after all these months, and I actually have the response from them. There are nurses that want to work new in the area. So what we did today is we went into Queen's Park to deliver a petition to stand up and show Sylvia Jones that this is not what is good for Minden. The HHS is not making a decision to save the hospitals. They're making a decision because, in my opinion, it's bad management. So close one to save the other is basically what they're doing. And it may or may not work. But it's funny today because while I was in Queen Park, I asked that specific question to our local MPP, Laurie Scott. Today we had a little bit of a discussion. And when I said to her, I said, well, what happens, say in 20 years, what's the plan? Well, let's not talk, that's an if. And I said, okay, what happens in 1 month? Say we close one and the doctors don't start showing up from the HFO, from the agencies, they're canceling their shift. She already said the doctors aren't coming from Minden. Well, thing is, what she said is when the Minden site closes, they will make sure if there's any trouble at the Haliburton site, that they won't let it happen. Well, the part that I don't understand is Sylvia Jones has been saying they're not gonna let it happen, they're not gonna let Haliburton site fail. Well, why are they letting Minden and Haliburton site fail now? If they don't have the power to step in now, how are they gonna have the power to step in June or in July? So that means they do have the power, and unfortunately, Sylvia Jones and the MOH need to step up. They need to say, you know what, we can do something about this. And they should do something about it now, not wait until, it's last second, oh my gosh, we're gonna close, and then do something about it. Do something about it now. Stick to your words. Be there for the residents of Minden and everybody that visits us. Do something now. Open the hospitals up. Let's work together. Let's make a plan, because you know what? There's a ton of nurses out there that wanna live in the beautiful country of Haliburton County.
Patrick, we are going to leave it there. Thank you so much for bringing the story forward. And Dr. Drummond, thank you so much for your take on this as well. Really appreciate both of your time.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.